Welcome to the JTV News Update. I am Sean Rose. 31 teachers from private and public primary and secondary schools completed a health and family life education training session on September 4. The training equipped teachers with the necessary skills to be effective in the delivery of interactive learning methodologies on sexuality and the sexual health component of health and family life. Sandra Berry of the Ministry of Education, Jamaica, facilitated the training, hosted in collaboration with the Ministries of Health and Education here in the BVI, along with the Pan American Health Organization and the European Union. The objective of the training session was to enable the educators to resolve issues which may arise in these areas in the new academic school year. Deputy Premier and the Minister for Natural Resources and Labour, Dr. Kedrick Pickering, has called for international partners to be more inclusive of overseas countries and territories when providing support to small island developing states or SIDS to implement the Sustainable Development Agenda. The Deputy Premier was addressing the United Nations Third International Conference on Small Island Developing States held in Samoa from August 31 to September 3rd.
In the past, international partners have tended to deliver assistance to SIDS in regional clusters, such as whether you're in the Caribbean or the Pacific. But too often, some of these islands in the clusters have been excluded based on political status. This approach, Mr. President, is unhelpful, and in some cases, it is regressive in achieving the sustainable development of all SIDS. A clear example of this is in the area of biodiversity. In the Caribbean, the Pacific, Indian Ocean, and other regions, islands are linked in part by their ecosystems. It is extremely difficult to effectively tackle marine issues such as invasive species, especially the lionfish, and other sustainable fisheries without the participation of all the islands in a cluster, each of which may not have the same political status, the Caribbean being a very specific example. Mr. President, it is important that for the future international partners utilize a more inclusive framework for SIDS that overcomes these barriers. This kind of critical thinking and approach is vitally important, especially, Mr. President, since ideas are the new currency for international cooperation.
The BVI was an active participant in the preparatory process leading up to the UN's Third International Conference on SIDS. The BVI attended the once-in-a-decade conference in its capacity as an associate member of ECLAC and as the chair of the Overseas Countries and Territories Association, the OCTA. The Physical Activity Subcommittee of the Interdepartmental Technical Working Group launched its Walk Run for Health program on Monday, September 8. Addressing the launch held at the Department of Youth Affairs and Sports, Chairman of the Interdepartmental Technical Working Group, BVI Health and Wellness Council, Honorable Archibald Christian, called for BVI residents to increase physical activity to help lower the rates of chronic diseases.
I would like to also point out that physical activity is a protective factor for the prevention of chronic diseases such as diabetes and high blood pressure. The BVI STEPS survey done in 2009 indicated that 43% of females and 24% of males between the age group of 25 and 64 years did not participate in sufficient physical activity to protect them from chronic diseases. The survey results also revealed that most of the physical activity done was work-related, and the amount of physical activity undertaken during leisure time was considerably less than would have been done during working hours for both male and females.
The BVI Olympic Committee, through Olympic Solidarity, contributed $10,000 to the campaign, which includes a 10,000 steps a day program. BVI Olympic Committee Secretary General Lloyd Black also called for increased levels of physical activity among residents.
I myself probably have not been walking as much as I should, but I can assure you, recently I've started doing at least 12 to 15 miles a week. So hopefully I would not be a statistics to some of the chronic health problems that we're afflicted with in our community. Nevertheless, the BVI Olympic Committee is pleased and proud to be a part of this initiative. And, I join in encouraging everyone, young and old, to be a bit more physically active. It can be a simple walk, in the morning or in the evening, or instead of, going to the shop when you need to go to the shop and, drive for 5 minutes, take a leisurely walk.
Acting Assistant Director of Sports and the Chairman of the Physical Activity Subcommittee for the Health and Wellness Council, Paul Hewlett, said 5 subcommittees have been set up to drive the various health initiatives.
The objective of the Run Walk for Health, as stated before, is to improve health and to reduce non-communicable diseases. It is an initiative which came about after the Interdepartmental Technical Working Group, which is TWG, we refer to it, headed by the Honorable Archibald Christian, and the dream child of Mr. Ivy George in the Department of Health appointed myself to head one of 5 subcommittees, which were all given the mandate of improving health and reducing non-communicable diseases through government and in partnership with the wider community at large. The 5 subcommittees are Healthy Spaces and Places, Healthy Schools, Food and Nutrition, Alcohol and Tobacco Issues, and my committee, the Physical Activity Committee.
A workforce walk-run event targeting public and private sector workers will kick off on Friday, September 12. For the JTV News Update, I am Sean Rose.